Good morning, everybody. Thanks for your understanding while we navigated some technical issues this morning, but we're ready to go. We might have a few more folks calling in, but we're going to get going here. So again, I'm Heather Thomas with the Joint Information Center for Snohomish County's response to COVID-19. I'm going to take a moment to click buttons to make sure that all of you media here have permission to record. As always, you will have permission to record, and we are also recording this meeting, and we'll post that on our YouTube channel and our social media later today. So just a moment here. Okay. I think I've given everybody permission, but if you run into any issues, please send a note through the chat box to the Joint Information Center and I will get that fixed. Unfortunately, Snohomish County Executive Dave Summers was unable to join us at the last minute this morning, so it will be some extra time with our Snohomish Health District Health Officer, Dr. Chris Spitters. After Dr. Spitters has shared his update, we will take questions using the chat feature. Please be sure to submit your questions to everyone so that all of us can see them. Thank you again for joining us, and with that, I'll turn it over to Dr. Spitters.
All right, thank you, Heather. Good morning, everyone. Let's start with an update on our COVID numbers. We had 1,374 cases reported last week. That's the week ending Saturday, November 20. That's down from 1,600 the prior week, so a slight reduction. That brought our 2-week case rate per 100,000 for the 2-week period ending Saturday, November 20, down from 361 to 352. So, you know, over the long haul, over the last couple months, it's been a little bit up and down again, but the long trend is a gradual decline, and that's where we're at. We'd like to see that going down more steeply, but you know, this is where we're at. And the hospitals have had a similar trend where they're down about 1/3 off of their peak of up over 100 hospitalized COVID cases at any one time, and now they're down in the high 60s, low 70s over the past week or two, with about 20 to 25 people being on ventilators at any one time. For those of you who watch our data a little more closely, you might have noticed an adjustment in an increase in both the gross cumulative total number of deaths and cases reported over previous weeks. Those were not recently occurring cases or deaths, but a backlog of previously unascertained cases and deaths, and they're distributed across time, their occurrences, and they don't change our understanding of the course of the pandemic. It's just a data update that happens occasionally in our world. On the vaccine side, demand continues to remain high for both pediatric doses among children ages 5 to 11 and for booster doses. For kids 5 to 11, 16.5%, that's about 11 or 12,000 kids had been vaccinated through midnight on Sunday. When you add all the doses up over the eligible population, we've got 68% have initiated vaccination and 62% are fully vaccinated. Now that sounds like a decrease from numbers we've reported recently, but remember that we've added the young kids into the denominator. So overall we've got about 565,000 people who have initiated vaccination, and about 90% of those have completed. Also, 92,000 booster or additional doses have been administered in 4 or 5 weeks since boosters were made available in the community. Additional updates, we've also published a number of our monthly reports recently covering race and ethnicity data, vaccination demographics, and more. You can find those all online at www.snohd.org/case counts, all one word. About booster recommendations that were expanded last Friday when the Advisory Committee on Immunization Practices for CDC met following FDA's extension of the authorization for booster doses on a regulatory basis. Then CDC's ACIP takes up the medical recommendation for their use. And so here's the summary. For adults who are age 50 and up, anyone who's been more than 6 months since a Pfizer or Moderna dose, or more than 2 months since their Johnson & Johnson dose, they're eligible for a booster dose. Younger adults down to age 18 are also eligible for boosters along the same line, 6 months since Moderna or Pfizer, or 2 months since Johnson & Johnson. And then the strongest recommendation is for individuals of any age with underlying medical conditions that increase their risk for severe disease, or who work in a setting where they have occupational exposure to COVID, and then individuals over age 50 who have underlying medical conditions as well, and over age 65, regardless of health status. Those are the strongest recommendations, but it's available for everyone, and we encourage you to pursue that. If you're eligible, you can find a vaccine near you at vaccines.gov or on our website at www.snohd.org/COVID vaccine. Lastly, as we head into the holiday weekend, we want to call your attention to the press release we put out last Friday, just giving pointers, reminders for how to have a safe gathering at Thanksgiving. Holiday traditions are important to us all, especially after the long time everyone's been going through the pandemic and the winter weather. Getting together with family and friends can help us all out. We just encourage you to do so wisely, with an eye on reducing your risk for transmission by virtue of vaccination, when appropriate, masking, ventilation, etc. Because many generations tend to gather and celebrate during the holidays, be particularly wary about exposing vulnerable or older adults, and for those who are unvaccinated, it's probably too late for vaccination to protect you for Thanksgiving, but still encourage you to consider doing that for the long run, and take those other prevention measures in account to avoid transmission during the holiday. We ask that you please share that information from that press release with your audiences. And if you missed it, Heather's going to post that link in the chat box now. By working together, we can enjoy safer holidays, travel, and protect our own health, as well as the health of our family and friends. So with that, I will turn it back to Heather. Heather.
Thank you, Dr. Spitters, and we will take questions in the chat box. So we'll give it just a minute for those questions to start popping through. All right, while we're waiting for questions, do want to give you a heads up that because of the holiday weekend and week, the health district will not be sending a press release this week. So our typical Friday press release will not be happening. We will post some vaccine and testing location and schedules on social media. So encourage you to look at that. Question, can you clarify if that 16.5% of pediatric doses were Snohomish County or statewide?
Yeah, yes, that's Snohomish County, 5 to 11-year-olds, 16.5%, or 12,375 approximately of the 75,000 kids in that age group who reside in Snohomish County have had their first dose of vaccine. Statewide, that figure is 14.2%. So, we're all right in there in that range, but we're a little bit ahead of the curve.
Next question is from Ryan at Como. Even though we're still on that steady decline, what are your expectations as we head into winter and other states are seeing increases in new cases?
Yeah, well, I think it's important for us all to take the long view here, which is that COVID is not going to be behind us anytime soon. And currently we're experiencing a decline. I hope that's a sustained decline that steepens as time passes. But the reality is, for the foreseeable future, we're still at a very high level of transmission, even though the trajectory is favorable. We've got hospitals that are still relatively full and a healthcare system that's stressed. We've got schools where we're trying to keep the kids in-person learning, but there are cases occurring there. That is an understandable and worthwhile distraction of the folks working on the campus to try not only to educate the kids, but also keep them safe and protect the school community. So there's a lot going on. And so for the foreseeable future, we just have to continue engaging in those common sense activities that we've been saying all along, mask up in public, especially indoors, and when you're outdoors and in a crowd, limit gathering size. When you do gather indoors, try to keep it well ventilated, and on and on, all those things. Spread out when you're in public spaces, all that. And when you travel, keep your distance from folks when you get back, get tested a few days after returning. All that's going to continue for the foreseeable future. And then there will come a day, probably not soon, because as we go through the winter months, people are inside, and I think we're going to see the decline or be slow. It could even go back up, as you're suggesting is occurring in other states. Certainly, I think it's highly unlikely that this fifth wave of COVID is the last one, and it's likely that we're going to be dealing with waves, hopefully of smaller intensity and duration, on into the future for, it could continue for several years, right? And the idea is for us all to have enough common sense for protecting one another and the vulnerable folks and limiting transmission so that we don't swamp the healthcare system, and having enough vaccine coverage to limit transmission and mitigate the personal effects of getting infected. So that if we do get infected, despite our best efforts at vaccination and prevention efforts, well, it's less likely to be a severe case. And I think that's kind of the mindset that we need to be in now. And as I said, for the foreseeable future. And, there's no date out there that's 2 weeks or 2 months or 6 months from now where we can say, it's all over, put away all the prevention measures and we're done. We're probably going to end up going into and coming out of periods of time where we need to raise our guard, and then things get better and we can lower it. But it's going to, in the long run, has to be a sustained effort. We got to be flexible, keep our eye on where things are at, and then respond appropriately as individuals and a community.
All right. Next question is from Claudia at the Herald. What's the availability of booster doses in Snohomish County? Should people expect the backlog or frustration that we're seeing with pediatric doses?
Yeah. Well, first, I'll answer that. The second part of the question or statement there. Yeah, there's been a fair amount of frustration that's already calming down. I think as more kids get vaccinated, well, then there's less competition for those spots. And that's just a fact of life. We've gone over that before. When you've got a supply that's roughly 1/10 of the demand, there's going to be some frustration and some waiting and some need to exercise patience. And I think everybody's done a good job with that. And we'll see this pediatric vaccine effort roll out. And I think it'll continue to do so. 16% done in less than 2 weeks. that's pretty good. So I think we're well on our way there. Having said that, the booster, again, there will be a surge of demand amongst those who are interested, willing, and able to pursue a booster dose. Most folks that I've talked to are scheduling 2 to 4 weeks out in community pharmacies. It's probably not dissimilar in the healthcare system. And so again, that's not unexpected, right? There's more interest than there is supply of vaccine and supply of, more importantly, slots to get vaccinated. And it's going to take a little while to work its way through, but go use those vaccine finder platforms and get a spot, and don't be surprised if it's 2 to 4 weeks off. And in the meantime and thereafter, continue to exercise those other prevention measures that layered together will protect you and all of us in the long run.
Next question is, how are we doing with cases or outbreaks in the schools?
Well, it's I would say cases in children, right? Most of whom are in school, but we don't, when there's high transmission in the community, it can be very difficult to sort out where that's being acquired. Having said that, the overall view on the school situation is that September was the toughest month. There were 60 episodes of 3 or more cases in a school environment that occurred within 14 days of each other and didn't appear to have another venue for transmission amongst the 3. That doesn't always mean that they caught it from each other, right? Because they could just have all gotten it separate places in the community. Then it shows up on that school's map and we call it an outbreak. That's because our goal is to have a very sensitive outbreak definition so that we can introduce prevention measures to mitigate any risk of transmission in the school. So then in October, I think it came down to 20, and thus far in November, I think we're in the 15 range, kind of on pace with October. So not much different November than October, but both months much better than September was. Rolling out the vaccination will help that. The schools are doing a great job assisting with the contact investigation and making sure that unvaccinated kids get quarantined. And then some of them are also doing tests to stay, where exposed children who remain healthy can stay in school but get tested periodically over the week of follow-up after their last exposure. So it's out there, it's having an impact, and the schools are doing a great job. We're working on it with them, and we expect that with the passage of time and the vaccination of the younger kids, we'll see this gradually improve with time over the coming months. Our kids, go ahead. Sorry, Heather.
No, you're fine.
Well, I just related question, right? At last check, about 20% of cases are among children ages 14 years and under. Over the long haul during the pandemic, it's been about 10%. So that's been ratcheted up since school came back in, and kids are having more activity and more contact with each other, both in and out of school. And so when you look at the case rate over time by age group, all through the end of October, all age groups were having a decline in COVID incidents, except for the younger kids, who were kind of going straight across after they peaked in September. And I suspect it's going to remain that way, despite everyone's best efforts, until we get reasonable vaccine coverage achieved, and we're already well on our way to getting that going.
I did just post a link to that report that Dr. Spitters referenced in the chat box. Question on the boosters. The language surrounding boosters tends to be very vague. Why not just recommend them for all? Are we in another tiered system reflective of the first vaccine rollout, or is there a potential risk to those without underlying conditions to get the booster?
The benefit to risk ratio for any adult to get a booster dose is favorable. And so anyone 18 years and up is eligible. The additional language is really, so anyone 18 and up, the language is may, M-A-Y, may pursue a booster. And the stronger recommendation is for older adults and people with underlying medical conditions or who live in long-term care facilities. They have a higher risk of severe disease. And that becomes the CDC says they should go get one, but anyone may, and we recommend anyone who's eligible, go get it done. And there's no, we're not in a phased approach where we're only letting certain subsets of eligible people get vaccinated. It's just, if the amount of time has passed and you're over 18, you're up to bat, go get it, get an appointment and get it done.
Question: in a recent Washington State Hospital Association, I guess, press briefing, they talked about their numbers, especially for people on ventilators, going down in part because some of the people were dying. Do you have a sense of Snohomish County's hospitalization decrease because of deaths versus recovery?
Well, there's multiple factors. I don't think that death is the main reason the hospitalizations or the hospital census are going down in Snohomish County. Although we have had a little bump in deaths, it's been 5 to 10 deaths per week during the peak of this sixth wave. You compare that to 50 to 60 deaths per week back with the third wave about a year ago. So again, and the difference in the size of those curves, almost 10 times greater number of deaths per week. A year ago. What's the difference? Vaccination. So there's another favorable observation supporting vaccination. So we're having fewer deaths, but there's still a lot of transmission going on, and there's still a lot of severe disease leading to hospitalization. Because of vaccination, there's less severe disease now, like leading to ICU admissions. And so some patients are getting discharged sooner. And in conversation with the medical leadership of Snohomish County hospitals, the vast majority of whom have been hospitalized at Providence Regional Medical Center in Everett, they do have a program trying to get patients out on home oxygen sooner than was being done earlier in the pandemic. So there's actually a program that once you kind of reach a certain level of, you still need some oxygen, but you seem to be out of harm's way. And, now they have 2 years of experience and I think have a better feel for who's going to do well at home. And they try to get those folks out. And so one of the things you'll notice about Snohomish County's hospital census when you look on the internet is that our per capita, the number of COVID hospitalized patients per capita is lower in Snohomish County than in King or Pierce or many other larger counties. And on the other hand, the proportion of cases on ventilators is higher. And again, that's because those less severe cases, at least in Snohomish County, they're getting them out quicker. And so there you have it. But even with that, even with all those efforts and that good side of the story, the hospitals have an ongoing surge of demand for delayed and routine medical care that can't be further delayed. And then this wave of COVID has really pushed them up to the edge, and in a context of having limited staffing. And so they're still challenged. We shouldn't think that the hospitals are out of the woods, even though the COVID situation is improving, and all the more reason for us all to try to work together to reduce COVID's contribution to the challenges that our acute care system is facing and the whole healthcare system. I suspect any of you who think about people in your life who are seeking both inpatient and outpatient care, it's a lot different now than it was 2 years ago. And one of the things we hope for returning to soon is a greater ease in getting medical care done as we get COVID, fewer and fewer, less and less demand upon the system from COVID.
That looks like the last of the questions, so we'll go ahead and wrap up for today. Again, thank you for your patience while we work through our technical issues, and a reminder that the Health District will not be sending a press release on Friday. We hope you all have a wonderful and safe and healthy holiday. See you in a couple weeks. Thank you.